everybody, today we're going to talk about the 5 things to know before you get surgery for your carpal tunnel problem. So I am Dr. Herzog with LeBauer Physical Therapy.
And my name is Dr. Aaron LeBauer.
Awesome. And then before we get into this, guys, be sure to click the subscribe link below or share with a friend who you think could benefit from this. So the 5 things you need to know before you get surgery for your carpal tunnel problem. A lot of people don't even know what carpal tunnel is. So what even is your carpal tunnel? Because we need to know what is a carpal tunnel before we know if there's a problem. Your carpal tunnel is just this area in your wrist right here, and there's a bunch of nerves and ligaments that run under it, and then there's a ligament that runs over it. So that right there is your carpal tunnel.
It's a really small space. It's supposed to be small, and it's just this anatomical name for this space in your wrist.
Yeah. So a lot of times when people are having wrist pain, that's kind of the first culprit or the thing people blame for wrist pain is your carpal tunnel. But what people don't know is there's a lot of different muscles in your shoulder, in your neck, that can actually refer pain down to your wrist. Honestly, carpal tunnel syndrome, it's just a name for a bunch of symptoms. A lot of times people experience numbness and tingling in their hand with carpal tunnel, or they just get a lot of pain when typing, but a lot of other problems can lead to those same symptoms.
Right. And one of the culprits is Dr. Google.
Yes.
Because what happens is we're oh, wrist pain, pain at the wrist. I'm sitting at my computer, ask Dr. Google. I go see my primary care provider, I think I have carpal tunnel. And they go, yeah, it looks like you do. But here's the thing is it may not actually be a carpal tunnel problem. It can be problems around it. There are a couple muscles in your shoulder that do refer pain all the way down here. Mm-hmm. There are muscles in your arm that start about at the elbow and cross here. And it can be a problem here in your wrist that's referring pain here. It may actually be when people say carpal tunnel syndrome, what that term specifically is trying to describe is an inflammatory process in this little space that's making it crowded and irritating the nerves and tendons. Mm-hmm. Especially if you've had an injection. If it still hurts after the injection would have reduced or gotten rid of the inflammation. Mm-hmm. And if it's still a problem after that, well, it's probably not the inflammation that's causing the pain and symptoms that you're having. Mm-hmm. So it might not be a carpal tunnel syndrome because carpal tunnel is this space, and if you're having wrist pain, then it can be somewhere completely different. What are some of the other problems that can cause pain down here in the wrist?
Yeah, so good question. A lot of times I see problems with the neck and the shoulder. So there's a couple muscles in your neck that, when you press on them, they reproduce those symptoms, and that's a good sign because it's hey, we found the problem, so we know we just need to loosen up your neck a little bit more and help your neck move better just to fix the problem, take away those symptoms. There's also some of your rotator cuff muscles. So a lot of the times their shoulder doesn't move well, and their rotator cuff muscles just get all tight and irritated, and those muscles can refer pain all the way down to your hand. And a lot of people don't know that, so they don't know, hey, I have wrist pain, but a lot of muscles up here will show symptoms down at my hand. So a lot of people just don't know to look up there.
What's one of the problems or other issues that might be causing people's muscles in their necks to stay tight?
A lot of the times I just see people with prolonged posture. So there's not really a good or a bad posture. The best posture is, hey, move every 30 minutes to an hour, or even just do some stretches. But I've seen a lot of people recently where they're just all hunched over, they get real focused in their work, and all of a sudden they look at the clock and they're like, wow, I've been at my computer for 3 hours and I haven't moved. Mm-hmm. And they just get that chronic tightness. A lot of it's too much overhead lifting a lot with bad form. Mm-hmm. So I'll see a lot of people that go to boot camp class, or they do water aerobics, stuff like that. And the only time they had their carpal tunnel symptoms was when they were lifting overhead. And it turned out it was just their shoulder and their neck was all not happy. And
that can sometimes be another kind of term that people call it a thoracic outlet syndrome.
Yep. Because
when you go overhead, it's, and it causes the problems. But it's the same thing as carpal tunnel syndrome. It's just describing a general region where there are problems. Mm-hmm. And it still takes some detective work.
Yeah.
So one of the other things I was thinking of was when you were describing how their neck muscles that can, when they're tight, like the scalenes, they can reproduce symptoms in your arm and wrist is people with breathing problems.
Ooh, yeah,
so
that's a big
breathing, inappropriate breathing also drives neck tightness because the muscles in your neck help elevate your rib cage, which open up your lungs, and that is the secondary or accessory breathing muscles. And they're supposed to do that. But if you're not using your diaphragm,
gotta use it.
If it's been shut down, like you have asthma or you've had other, injuries, maybe a baby and your diaphragm and your pelvic floor aren't working well together, then you're going to breathe more in your upper chest. And as those muscles stay tight, sometimes it's not the tightness that causes the symptoms, it's like the overload of your body with the different stressors. So it could be a lift, or it could be holding a baby, it could be just being stressed at work, not getting enough massage, and your body's amped up, and these muscles, the one or two muscles will spasm. Now you've got a symptom down here, these don't let go, and we're looking at getting surgery for our wrist, but the symptom comes from here, and the problem is more of a breathing problem, maybe because you had a baby, your pelvic floor's not working, and you don't breathe right, because you're breathing here in belly, not with the diaphragm, which is one of the biggest muscles in our body. It's like a big flat muscle.
For a lot of people under chronic stress, they just stop using their diaphragm just because they're so stressed and they're just shallow breathing all day and not taking those deep breaths and using their diaphragm.
It's like the solar plexus. It's the center. When that gets locked down, the diaphragm gets locked down. So here's the thing with surgery. A lot of times the patients have come to us and said, oh, well, my doctor says it's just routine surgery. Well, that's okay. Dr. LeBauer is telling you that routine surgery is great on the physicians and surgeons side. Like, it better be routine for them. But surgery is never going to be routine for you. It's not something that you do on a regular basis, like walking and exercise. So when you have surgery, that means a minimum of 6 weeks of recovery, because it takes a minimum of 6 weeks for tissues to heal, probably 8 weeks. And if your wrist is locked down in a brace for a while, it's going to probably take 3 to 6 months to get your motion back and your strength back. And was it every week that you lay in bed, it takes how many, 6 weeks, or what was the statistic to get back to that higher level?
6,
yeah. So just imagine, even if you're not laying in bed, every week that your arm is immobilized, it's going to take another 6 weeks to get your strength and mobility back. And that's a long time, where generally with people in about 3 to 5 visits, which is somewhere between 2 to 5 weeks, we make a huge difference in your symptoms and your ability to work, run, play, lift, carry, whatever it is that you're struggling with the symptoms. And surgery will always be there, but a lot of people don't actually know that we can help you with these problems. So I just want you to know, we can help. Not all physical therapists can help, not all surgeons can help, and not all massage can help. But what we specialize in is looking at, where's the problem, where's it coming from. We're like detectives, we want to know, and snipers, we want to know where's that one place that it's coming from. So let's fix the issue that's bothering you day to day, let's find out where it's coming from, and then make sure that we talk to you about your overall goals and where do you want to be next year? Where do we want you to be in 6 months so that this doesn't happen again, right? And so that it doesn't happen repetitively, where we don't have to have a problem on the other side. Right?
Because, that happens a lot.
Right, because it's not hereditary, and just because it happens on one side doesn't mean it happens on the other. So how do we be sure that we fix this long term?
Go see a PT. Even if you have had surgery, like you mentioned, go see a PT if you start to feel stuff on the other side, or even just to make sure you get that strength and range of motion back. But definitely see a PT, even just for a second opinion, if you're even considering the surgery, just like you said, to see, hey, is the problem actually at the carpal tunnel, or is something deeper going on? But so I would definitely say come in, and we offer what we call total body diagnostics, which is just a no-cost obligation 20 to 25 minute appointment with us, where we take a look at you head to toe. That way we make sure, we're not missing the problem. So it could even be going on, like we said, from the diaphragm. So we do look head to toe and then kind of chat about what we think your next step should be, whether that be, oh, that really is the problem, you should get surgery, or hey, we can help you, massage can help you, or yoga, or any of our services. So if that's something that you think would be helpful to you, feel free to give us a call at 336-271-6677. Awesome. And then don't forget to click subscribe below. Leave us a comment with something that you learned, and share with your friends as well.
Right. And if you want to get in touch with us, there should be a link below. You can hit us up at LeBauerPT.com, Instagram at LeBauerPT, and share this, like, subscribe, but really take a second look at your body and what's going on, and make sure that as a healthcare consumer, as someone who's going to see physicians and doctors and physical therapists, you're asking questions. And if someone doesn't know the answer, there is an answer out there for you.
Be your best advocate.
Be your own best advocate. We'll see you next time.